What is social anxiety disorder? We all know the feeling of being nervous or uncomfortable in a social situation. Maybe you've clammed up when meeting someone new or gotten sweaty palms before making a big presentation. Public speaking or walking into a room full of strangers isn't exactly thrilling for everybody, but most people can get through it. Social anxiety disorder, sometimes referred to as social phobia, is a type of anxiety disorder that causes extreme fear in social settings. People with this disorder have trouble talking to people, meeting new people, and attending social gatherings. They fear being judged or scrutinized by others. They may understand that their fears are irrational or unreasonable, but feel powerless to overcome them. Social anxiety disorder has many effects on the body and mind, causing physical, emotional, and behavioral symptoms. Symptoms of social anxiety disorder. 1. Physical symptoms, such as blushing, sweating, trembling, nausea, an increased heart rate, and the mind going blank. 2. Feelings of panic or panic attacks. 3. A fear of experiencing anxiety or of seeming anxious in front of others. 4. An intense fear of judgment from others. 5. Feelings of fear or dread in situations with other people, especially strangers. 6. Feeling very self-conscious, embarrassed, or awkward in front of others. 7. Having difficulty speaking. 8. Avoiding situations that might trigger anxiety. 9. A rigid body posture and a soft voice during social interactions. 10. Difficulty making or maintaining eye contact. 11. Sensitivity to criticism, low self-esteem, and negative self-talk. These symptoms can greatly disrupt daily life, such as school, work, and relationships. Without treatment, the person may not achieve their potential at school or work, as they may avoid participating in group tasks, speaking in front of groups, or receiving a promotion. When severe or chronic, social anxiety can lead to the development of other conditions, such as depression or substance use disorders. What are the treatments for social anxiety disorder? It may not be easy at first to seek help for a condition like social anxiety disorder, which can make you reluctant to speak to strangers. But if you're at the point where you avoid social contact and it's started to control your life, you should talk to a mental health professional. There are a lot of treatments that can help. Social anxiety disorder, also called social phobia, causes overwhelming fear of social situations, from parties and dating, to public speaking and eating in restaurants. When you cut yourself off because of social anxiety, you might feel depressed and have low self-esteem. You might have negative or even suicidal thoughts. If you've been avoiding certain social situations for at least a few months and have been under severe stress because of it, it's time to get treatment. Social anxiety therapy. The best way to treat social anxiety is through cognitive behavioral therapy or medication, and often both. You generally need about 12 to 16 therapy sessions. The goal is to build confidence, learn skills that help you manage the situations that scare you most, and then get out into the world. Teamwork is key in social anxiety therapy. You and your therapist will work together to identify your negative thoughts and start to change them. You'll need to focus on the present instead of what happened in the past. You might do role-playing and social skills training as part of your therapy. Maybe you'll get lessons in public speaking or learn how to navigate a party of strangers. Between sessions, you'll practice on your own. A big part of getting better is taking care of yourself. If you exercise, get enough sleep, and limit alcohol and caffeine, you'll be more focused for the mental challenges of therapy. Medication for social anxiety disorder. Your doctor may suggest antidepressants to treat your social anxiety disorder. For instance, they may prescribe drugs known as SSRIs, selective serotonin reuptake inhibitors, such as fluoxetine, Prozac, paroxetine, Paxil, sertraline, Zoloft. Your doctor may also suggest antidepressants called SNRIs, selective serotonin and norepinephrine reuptake inhibitors. Some examples are duloxetine, Cymbalta; venlafaxine, Effexor. Keep in mind that medicine alone won't be a quick fix for your anxiety. You'll have to wait for it to take effect. 2 to 6 weeks is a good guideline. And it might take a while to figure out side effects and find the right fit. Some people are able to wean off medication after a few months, and others need to stay on it if their symptoms start to come back. You might find that the first course of treatment eases all of your anxiety. Or it might be a longer journey. But taking those first steps will lead you to a less stressful life. If you have come this far, it is because perhaps you are looking for a solution for social anxiety. That is why today we invite you to discover the 3 worst mistakes you must avoid if you want to eliminate social anxiety. Click the description link and the first comment. You will never suffer from social anxiety again. Thanks for reaching the end of our video. Subscribe to not miss any of our future videos. Also, if possible, like, comment and share with all your friends. Your help will be of vital importance for our growth. See you soon.